So this is very important in angina, that is we need to maintain the demand and supply gap. We have to see that how we can reduce the demand and supply gap so that the heart is receiving proper energy components for its function. So as I told you, the classification wise angina, it will depend on what? It will depend on how much demand supply is there. Okay. First one is known as a stable angina. Stable means which is otherwise there are no sign symptoms. But whenever the person is doing any kind of physical or mental work or exercise, then the demand increases, and when the demand increases, then the supply cannot meet, otherwise the supply is normal. Okay. So it's something like that in the summer days, the water level go down and plant need more water, so isn't it? So then during summer only the many places are having problem, that the plants or everybody needs water, and because of summer the water level has gone down. Okay. So there are both problems simultaneously occur, the demand has increased and supply is reduced. So in that cases similar happens, that the person is exercising, what's your running, walking, climbing staircases, etc. So earlier there were no symptoms or very minimum symptoms were there, but immediately the person goes for exercise, the sign symptoms, that is discomfortness or tightness in pain, tightness or pain in the chest or the arm, and that will be there. So this is what the stable angina is. Okay. Then next one is unstable angina. Unstable angina, also called as a crescendo angina or acute coronary syndrome, ACS. In some cases acute cardiac symptom it is there, and it is what that the person has not taken much care, and what happened because of that, the demand supply problem is increasing day by day. Now it reaches to such a place that during rest only also the sufficient blood is not going to the heart, or heart is not receiving sufficient material, and during rest also the person is having problem. This is called as a unstable angina. Okay. This was also called as a Prince metal angina earlier. So these are various kind of anginas. Then one more thing is there, that is cardiac syndrome X. It is known as a microvascular angina, which is characterized by angina like chest pain, and particularly it is in epicardial coronary arteries, and it is also there, that is ischemic changes on exercise. The coronary arteries are normal, but still it shows the problem of less oxygen. The causes are not known, but maybe because of the endothelial dysfunction and because of the decrease in the flow in those very small blood vessels or tiny resistance blood vessel in the heart, and it is not characterized by major arterial blockage. It is very difficult to recognize and diagnose, and then it can become very dangerous in many persons, particularly in women it is more, and therefore it needs to be taken care of. Okay. So sign and symptom, already I told you what are the sign symptom: pressure, heaviness, tightness in the heart, then burning, choking sensation, may be experiencing epigastrium, that is upper central abdominal pain, back, neck area, jaw and shoulder pain in all this area. Already I told you this is called as a referred pain. Referred pain means, I told you, the pain is somewhere else, pain is only in heart, not anywhere, but our neuronal system feels that it is coming from these areas. Okay. This is because of the brachial plexus which is there in the shoulder area. So these are there, and because of that the pain is sensed, and many times it is causing confusion in the patient. They may apply some cream or some ointment to the hand, and they will feel that it is a muscular pain, and they will apply the muscular relaxants, etc., etc., or they may feel that it is acidity and they may take something, but actually it can be the problem, and many times because of that it becomes severe one, and they do not able to take any care. Some other symptoms also be there, like nausea, vomiting can be there, particularly in as the demand supply gap is widened. If it is more, what are the these what we can say, what are the risk factors? There are many risk factors: cigarette smoking, alcohol drinking, diabetes, cholesterol, high blood pressure, sedentary lifestyle. Sedentary lifestyle means आराम की ज़िंदगी जिसको बोलते हैं, no exercises and all, and family history of premature heart diseases. So these are the major risk factors in the angina. As I told you, one more problem, unstable angina is there, that is called as a Prinzmetal's angina. It occurs in the patient, they have normal coronary arteries, or they don't have much atherosclerosis, but all of a sudden spasms are developed in the arteries, particularly in the younger women. Okay, even men can have, but the chances are they are more. Then these various anginas, as I told you, this they are having so many risk factors like diabetes, smoking, dyslipidemia, hypertension, etc. Okay. Now what should be our treatment? We understood something about angina. We have seen few things about angina. What are the things about angina? Is the most important thing is it is because of the demand and supply. Now for you, homework is there in the meanwhile. You might have not studied it earlier, but you will study now. What is preload, what is afterload? You can write it down. I'll ask you in next class, what do you mean by preload, what do you mean by afterload? Then what is the Frank-Starling law of cardiac contraction? Okay, what happens with the cardiac contraction? This will also help us in congestive cardiac failure, that is called as a Frank-Starling law. Okay, what is the impact of the feeling, that is diastolic feeling in the heart? जब हार्ट में डायस्टोलिक फीलिंग होती है तो उसका क्या इम्पैक्ट होता है ब्लड सर्कुलेशन पर? व्हाट हैपन्स टू कोरोनरी ब्लड सप्लाई ड्यूरिंग कॉन्ट्रैक्शन एंड रिलैक्सेशन? व्हेन हार्ट इज कॉन्ट्रैक्टिंग, व्हाट हैपन्स टू द ब्लड सप्लाई, एंड व्हेन हार्ट इज रिलैक्सिंग, व्हाट इज हैपनिंग टू द ब्लड सप्लाई? I expect all these things you are reading it, okay, so that many concept will be clear. Now I like to ask you the drugs which can be useful in any case. Tell me about the drugs which can either reduce the demand or either increase the supply, or which can do both, decrease in demand and increase in supply. Okay, as I told you many a times, most of the time there can be other reasons also, but most of the time the reason is the problems with the coronary artery. That coronary artery has got a spasm or atherosclerosis. Atherosclerosis, last year you might have studied in pathophysiology what atherosclerosis is. That atherosclerosis causes the decrease in the lumen size of the artery, and it is particularly more with the arteries where the friction is more, and coronary artery is one of the artery where the friction is more. So in this artery, coronary artery is having highest susceptibility of having atherosclerosis. Okay, it is because of the hyperlipidemia and because of fat cells, and there are many reasons. I hope you, if not, then you please go back to atherosclerosis. We shall be also having atherosclerosis, but you can in the meanwhile briefly go the pathophysiology of atherosclerosis. What are various theories for atherosclerosis? I hope you remember in Hirschman it was nicely given. So this atherosclerosis, you go through it and you revise it, what is atherosclerosis. Now I'll just give you idea that maybe, okay, yes, there is atherosclerosis, or because of any reason there is a decrease in the supply. Okay, then what you will do for this? Again, if you will go for the physiology, please you have good revision of the cardiovascular physiology. I told you during hypertension also, I am repeating now. Suppose anything happens if heart is not getting sufficient energy, and if it cannot pump it sufficiently, then the reflex mechanism will work, cardiovascular center will do something, and it will cause what actions. So you please go through this, okay? If you are not understood, you can ask me, we can do about it, but please see that you are thorough in cardiovascular system pathophysiology, physiology also and pathology also. Whatsoever you have studied, not beyond that. If you can read beyond that, it is well and good, but at least whatsoever you have read, you should have good information about the things you have studied earlier. So our job is now to characterize the drugs, to classify the drugs. Can anybody tell me the drugs which can cause decrease in the demand or increase in the supply, or both? One by one, you will mention the name of give the drugs or class of the drugs and how they will doing whatsoever action you feel. Okay, can you tell me? No answers? Nobody knows. Pallavi sir don't know about it. Okay. Very good. In what condition the demand will increase? Which are the conditions where the demand of the nutrients energy will increase? Working condition. But heart is working continuously. Then what about it? Okay, in exercise and stress the demand will be increased. Why it will increase? Because more blood flow is required. Okay. Now apart from that, what are the conditions in which it can increase? You think about few things again. Suppose there are two persons, one is having normal blood pressure, one is having hypertension. in which condition the demand will increase, in which condition heart will have more work. Okay. Now suppose if somebody tries to reduce the blood pressure, can it decrease the demand of heart? Suppose we have got any drug which causes decrease in blood pressure, can it decrease the demand by heart? Okay. Now if you have got any pump, electric pump is there, electric motor is there for water circulation. Okay. And what happened is, if you are having two types of pipes, one is having diameter of 10 centimeter, other is having diameter of 6 centimeter. Okay, where the pump will have to put more energy. Why? So if the heart is doing it, and if you cause decrease in increase in the diameter of arteries, if you cause the increase in the area or increase in the diameter of arteries, what will happen on to the heart? The workload will increase or decrease? What is correct? Increase, decrease? To increase, to decrease? Saba Nivedita say. Why blood will be inadequate, Vaibhavi? Blood is same. We are not changing the blood volume. Only what we are doing is we are increasing the diameter of arteries by a fraction, by a small thing. So what will happen because of that? If the blood pressure is decreased, what will happen? Blood pressure will decrease. What will happen to the workload on the heart? Workload of the heart will increase or decrease? If workload decreases, then what will happen? Demand will increase or decrease? What will happen to demand? When demand is more, when workload is more, then demand is more, or when workload is less, then demand is more? So when I am changing the diameter, I am increasing the diameter, I am causing vasodilation. My question is, what will happen to the load on heart? Workload on heart is increasing or decreasing? If I am yes, if workload is decreasing, then what will happen to the demand? So yes, what's your, now these questions you can answer much better. You go through again heart physiology, as I told you, you write down the points I am asking about. I want what will happen with all, what will happen because of the changes in the blood pressure. If blood pressure is reduced, what will happen? If blood pressure is increased, what will happen? If blood volume increase, what will happen? If blood volume decrease, what will happen? You can write it down, my questions. What will be the impact of blood volume increase or decrease? What will happen because of the arteries? What do you mean by preload? What do you mean by afterload? I want the answers on WhatsApp group. Okay, this is sort of assignment, I want it by tomorrow. What do you mean by preload? What do you mean by afterload? What will happen to the demand when the heart rate is decrease or increase? If the heart rate is increase, what will happen to demand? And what will happen to demand if the heart rate is increase? What will happen to demand if force of contraction increases? And what will happen? That's what, these all answers I want to know, Pallavi. Okay, you go through it, because I told you, you read cardiovascular. These are all, actually these all answers are there in physiology of heart. Okay, so what is preload? What is up? I am repeating question third time. What is preload? What is afterload? What will be the impact of blood volume on the workload of heart? Increase or decrease of blood volume will, what it will cause? What will have the impact of increase or decrease in the heart rate, or increase or decrease in the force of contraction on that? I told you about something, Frank Starling law. I told you about the impact of contractions on the coronary blood flow. Okay, these all answers I want. You can enlist this on WhatsApp group and give question wise answers. By tomorrow morning I want, and then we'll start discussion about the next things. Okay, which are the drugs which are used in angina and how they are useful. Okay, so go through it, and if you are not studying, then I'll directly start with the drugs, but this basic is important. So basic, once it is clear, what do you mean by preload? Somebody asks you about preload, you should be able to even answer it at midnight in full sleep. What is preload? What is afterload? And what are the impacts of each and everything? So once you understand this physiology and pathology, then angina is very easy for you. Okay, then only mechanism of the drugs, but you will be understanding how the drug is effective, why this drug is having benefits, and it will also help you in your therapeutics. So take care, and I am not happy to see actually that you people have become lethargic. I was giving your examples that this class is good today only 14 students are there. Actually, many times I told third year students that your batch is very sincere. Almost more than 20-25 students, they are appearing classes regularly, and they even try to do the things meticulously. But I was just observing you. In last week, nobody reminded that we have not had any class. uh, Nobody is taking any call on that. So that seems that you people have become lethargic, uh, and nobody has asked any question, nobody has read anything about it. So this is not a good sign. uh, from the batch I was thinking